Hi, it's Christian again from WildHawk Physical Therapy.
And I'm Ashley with Wellness Warriors and Wisdom Massage Therapy.
And today we're going to be talking about the piriformis, which is a hip muscle. It also can be called Piriformis Syndrome when that area is affected. And it also can give you some kind of sciatic nerve issues and symptoms.
Yeah, it's a really good one to talk about. I see people come into my office all the time complaining of pain down their leg, sharp shooting pain, tightness, and they're always surprised when I mention the word piriformis because a lot of people hadn't even heard of it before.
Yeah, and it can be really challenging to try to figure out where that pain's coming from because in all reality, sometimes it's not the piriformis, sometimes it's not the sciatic nerve specifically, but it can be coming from the lower back or a different muscle in the hip. Because with trigger points, that can refer pain to different areas of the body. So maybe I, press on a painful area in my hip, but I feel the pain further down the leg. So that is a possibility too. So it's not as simple as saying this is kind of the one area that everyone deals with.
Yes, absolutely. Usually when someone comes to my office complaining of symptoms of pain, a lot of times they'll say, gosh, my lower back hurts. And that's the first little red flag that goes off in my mind as a therapist saying, all right, do you feel any pain in X, Y, and Z areas? Because this is going to tell us a story of where the pain actually might be coming from. And like you said, it might not even be the piriformis. But I've seen many times if they've got some of these symptoms like that lower back pain, tightness in the hip, that sharp shooting pain down the leg, a lot of times it ends up being that little piriformis muscle.
Yeah, and with what we do for our assessment evaluation is, if really they're having pain in multiple areas and it includes their lower back, we're automatically looking at the back as a part of our scan. But when we get down to the piriformis, when we look at it, we're trying to see if we can reproduce kind of that pain, that same pain that they've been having either in their hip or down the leg. So directly applying pressure to that muscle, sometimes we can see that reproduced. That's part of our exam. Other things that we look for is how the hip is moving. So when we see this piriformis syndrome or a really tight piriformis muscle, we can see some movements in the hip that are restricted. And particularly when we kind of bring the knee toward the chest, we call it the malretracted hip, or at least that's kind of my training with what I've seen, is that you bring that knee toward the chest and it starts to veer off toward the side, away from the body. And that's a good way that I can tell that, okay, we might have a tight piriformis, and it's influencing how that hip's tracking. And then, we test strength and see if there's any weakness in the hip, because a tight muscle usually affects the hip in terms of a weakness. So looking at those things together, we can kind of piece together that we see that piriformis being a problem.
Yeah, absolutely. Some of the ways that I, as a massage therapist, will test that theory as well to find out if it's the piriformis or otherwise. I'm going to treat a large part of the body just to kind of its process of elimination. You're going to go through different muscles, and I usually start with the lower back. I feel those muscles, and that can a lot of times tell me just by palpating with my hands, tells me, is it coming from further north up towards the shoulders, or is it coming from more around the hip area? And if it is coming towards the hip area, then I get a conversation going with my client and ask them, like, is it okay to work on the glute region? And I do that fully covered with, people get a little shy sometimes, and I always make sure that they're comfortable and they're completely covered. And I feel around with closed fists and also even with my forearm and elbow to see, does that muscle kick back at me? It's interesting, when I rub over a piriformis that is inflamed, very quickly it will almost pop up at my elbow here or my forearm, and that tells me that it's angry, it's mad, and a lot of times it's really tight. Another way is when I find that spot, I hold pressure like you were talking, and I ask them about, do you feel pain? is this similar to the pain that you've experienced before? And if that's the case, then we typically have found our little area that we need to zone in on. And then I also will activate those muscles by moving the leg around, and that helps tell me the health of that muscle. Is it, you know, easily activated, or is it really weak and worn out? And that helps me decide how we're supposed to kind of move forward with the treatment, with both what I need to do and what the client needs to do as well.
Oh, for sure. Yeah, and you know, we see a variety of irritabilities in this muscle. So it could be maybe, you know, a little bit irritated, and we really need to go in and release that muscle. But when it's super irritable, we have to back off a little bit and go a little bit more gently. So if you're experiencing some issues like that, you're really going to want to go see a professional who can kind of recommend how much to go, because you may be going too hard with some stretches, some exercises. The way we treat it is hands-on as well. So we'll either do some muscle release with our hands. If we go a little bit more aggressive, I like to dry needle that area, and that really helps. We do that with some electrical stimulation as well to help really relax that piriformis muscle. And then there's a manipulation for the hip, where I get a patient lying on their side, and I do a quick thrust over the top of the hip, and that helps neuromuscularly reset that muscle. It's kind of cool. And then I look at that tracking of the hip again to see how is it moving. And a lot of times after doing you know, that type of treatment, we see that it tracks normally and it starts to move well again. So that's a few approaches that we do to treat that. And you know, well, like we were talking about earlier, it can kind of affect the sciatic nerve too. So you may want to do some sciatic nerve glides. We also call it flossing. So it's just kind of moving the leg up and down in a certain way to get that nerve to easily, gently stretch. And sometimes, depending on how irritable it is, you have to be super sensitive with that.
Yeah, for sure. I often tell my clients that come to see me, this is not just a one and done kind of deal, especially if someone's been suffering with some sciatic pain. I talk to them about what this means and where it's potentially coming from and how I can help it. But not to think that they're gonna walk out of my office being 100% cured. It usually takes several sessions. They see improvement with each session, but it usually takes several by the time they can really see some dissipation in that sciatic pain. I also warn them, like, don't jump off my table and go run a marathon today. Like, you know, give it a day or two and then start building back up to your normal routine. What do you tell your patients when they are having some major issues once they leave your office?
Absolutely. So I never like to say, you know, I never try to say don't go do your regular things, but more of how can we modify them for now, where you can do maybe a little bit of what you've normally been doing, but giving the area some rest so that it can heal and then you can really move past it so that you can get back to 100%. So usually, you know, if someone's running and it hurts with running, I say, well, I want you to ease off on running for now. So that's the biggest thing is not trying to take away everything, but maybe toning it down a little bit.
For sure, yeah. Inactivity, I'm sure as you've seen, can cause just as many problems as overdoing it.
Right.
So it's all about kind of finding that balance. If you're a super active person, stay being active. If you shut yourself down because you feel a little pain or discomfort, that can actually cause some atrophy and some other issues you didn't have before. So healthy movement within balance is really important, and it keeps that blood flow going, which is going to help promote some healing.
Absolutely. Yeah. So if you're suffering from piriformis or sciatic issues, or you know someone who is, let them know. You know, the specialists are going to be physical therapists, massage therapy, where they're really using their hands to identify these areas and try to get you back feeling well and moving well. Thanks for tuning in. This is Christian again from WildHawk Physical Therapy.
And Ashley with Wellness Warriors and Wisdom Massage Therapy.
Thank you.